Okay, so hello, I'm Jan Bronick, and this is Helen Smith, and we are heart failure care coordinators / clinical nurse leaders here at St. Luke's University Health Network in Bethlehem. We work in an outpatient heart failure program that is, the goals are to improve outcomes and reduce avoidable readmissions. And in our clinical nurse leader role, we're definitely looking at quality outcomes, improving processes, trying to get evidence-based practice processes throughout our network.
Where do you practice primarily?
Primarily, we practice in the outpatient area. We have 6 campuses, and Helen and I have shared the responsibilities with those campuses.
What was the impetus for the both of you to choose the clinical nurse leader role?
It was free. Our hospital is very much looking to improve outcomes for the heart failure patient. So they looked at this role, the clinical nurse leader role, as a partnership with Moravian College. What we did is we had been offered to, we were selected, I should say, to be in the CNL role, at the center of our attention. And as a clinical nurse leader, what we're looking for is what's going on, what's the problems, and how do we integrate care and make it better for that patient. And basically, we weren't sure what we wanted to do for the rest of our lives, being in our early 50s. So now we decided that clinical nurse leader, it's not a prescriptive role. It took us 2.5 years to get it done, and the hospital was really partnering with the college that we went to. So that's why we decided to do it. Also, it basically is a little different. It looks at evidence-based and quality, and that's what we were looking for too, to help improve the outcomes for the heart failure patient.
Jan, as I read the literature, there's many assumptions within the role of the clinical nurse leader. Can you describe a little bit about what assumptions that you focus in on within the health system here?
Well, our role as a heart failure care coordinator, you really have to look at the care coordinator part of it, and what does a care coordinator do? Number one is we try to make every patient.
Jan, do you have anything to add to that?
Well, another tenet or assumption from the clinical nurse leader role is something called a microsystem assessment. That really, in where we're at, we're kind of have the heart failure program as our microsystem. You look at the process, you look at the people, the processes, the patients, and see where are the gaps. You know, where are we falling off in what's best practice to do, and then we plug in those sorts of things. Having follow-up appointments for our heart failure patients is something that's very important within a week of discharge. That's something that is evidence-based, that is shown to reduce avoidable readmissions. The microsystem assessment is something also, the leadership that we have in our program. We have nurse practitioners that are actually, you know, under us as far as, you know, management goes. Everybody has a role to play, and our nurse practitioner and our other physician's assistant, they see our outpatient heart failure patients, but they're not responsible for the quality outcomes. Helen and I, we look at our numbers, and we're ultimately responsible for outcomes, whereas your mid-level providers are more responsible for the medical therapies. They do some teaching in the office too, but they don't have the 360 view. That's what a clinical nurse leader has. They have that view of the whole program and can see if it's going the way it should go and where we need to make changes. This year are about 15%, which is just phenomenal. That number represents about a 42% reduction at our Bethlehem campus, which was our main campus, and about a 33% network-wide since we started our clinical nurse leader role. So our role has more than paid for penalties, which were almost, you know, $800,000 for the network for more than just heart failure. But these sorts of roles for a clinical nurse leader, I don't know how hospitals can live without them, really, because I think that you really, if you want to get the job done, I think they realize you need that expert nurse to figure it out. And I think that's where, you know, the clinical nurse leader role comes in. Everybody plays a part, but the clinical nurse leader really is someone who can determine outcomes and best processes for whatever microsystem. The VA system is probably one of the biggest proponents of the clinical nurse leader role. The VA system was similar when nurse practitioners came out in the 70s. They said, oh, they probably won't last, and the VA system picked them up and moved along into the 80s, and now look at nurse practitioners. So I think the clinical nurse leader role will probably be something similar.
And Jen and I, when we graduated with our masters, had to do a capstone project, and both of our capstone projects are now in play in the work that we do. Which I did the palliative care program for heart failure patients, Jan did a skilled nursing facility initiative, and it's really made a difference. We've had skilled nursing facility nurses say to us, thank you for being there for us, because of you, our readmission rate is lower. It's very much an interdisciplinary team that we really try to focus in on. Everybody have to be a part of the team, and the patient is the center of that team. And how are we going to make their lives better?
What credentialing was needed for your role?
Well, obviously you have to have a bachelor's degree to enter into the clinical nurse leader program. It's a master's program in clinical nurse leader, but then you have to take a certification exam, which, by the way, was very grueling. Just putting it out there, it was really grueling. The clinical nurse leaders throughout the country, there's some great stuff going on. I think it's just not really big right here in Pennsylvania. I think it's growing. I think there's maybe 2,000 or less than 2,000 clinical nurse leaders in the country. So it's getting out there, but it's very exciting. And so there is a credentialing part too.
Are there any barriers? I'm sure there are. Can you talk to us a little bit about the barriers that you've had to work through and overcome to be successful with all your outcomes?
Well, I think, everyone always has monetary or financial barriers, and I think we do as well. Although I think because of the changes, like I had said, in the monies that have been saved with our role, it's been less. But even getting the resources we needed in our own little office area here, we've grown and we've had other responsibilities. So just having the resources to make phone calls, because aside from the administrative part that we do the follow-up phone calls. So they did allow us to have some nurses, but getting people into the program and getting that through, that's a barrier, but really very small. I would say overall, we're pretty lucky we don't have a lot of barriers. I think there's a lot of them.
If either of you had to do it all over again, money aside, what advice, would you choose a different master's path to enroll in? And what advice do you have for any students coming into or pursuing master's level work in nursing?
I don't think if I knew what this was before, I wanted to be a nurse practitioner. And that's what I really thought my role was going to be. And I think the opportunity now to go out and preach CNL is where I would want to be. I think it's going to change nursing, the clinical nurse leader role, more than a nurse practitioner is, because I think a nurse practitioner at this point right now is all medical, where we're still nursing. We're still looking at the process of nursing, the assessment, the evaluation, how we're going to make things change and how we're going to improve things. Before, though, if it wasn't given an opportunity for me to take this, I probably would not have done it. But now looking back, I'm glad I'm here as a CNL now that I can preach, go for it.
And I feel the same way. I think that, actually, I think I knew more that would be something I wanted to do even before, whereas I'm like Helen was saying she wanted to be a nurse practitioner. I knew I didn't want to be a nurse practitioner, and I didn't want to be administrative, and I didn't want to teach nursing, and I really wasn't sure. I'd been a bedside nurse, and I felt like I was the expert nurse on my floor. Because of being a nurse for so long. And I think that clinical nurse leader role, particularly in the inpatient setting, really takes that expert nurse and gives her some ability to bring evidence-based.
Well, I would like to thank both of you for taking time out of your day. I know you're very busy here today. I'd like to thank you on behalf of my fellow colleagues within my class and myself.